Good morning, everyone. My name is Ki-Hong Kim, working in Seoul National University Hospital, Department of Emergency Medicine. I would like to introduce recent published research article to PATOS Young Investigator group members. This article is a new index to predict the possibility of hemostatic angiographic embolization in trauma patients assessed by emergency medical services, which has been published in Signavita Journal last year. This research was conducted with Professor Ju Zhang together. Let me give some concise background of study. As we all know about trauma, it is one of the major global health burden, especially in perspective of health issue in young population and need for optimizing emergency medical service system. Since emergency medical resource such as procedure or surgery should be efficiently located, regionalization is crucial, such as trauma center. For EMS provider, of course, pre-hospital care is important for surviving patients, but also assessing severity to decide receiving hospital is very critical. Many pre-hospital triage tool was developed to identify the need for intensive care, such as transfusion, CPR, or ICU admission. In perspective of emergency physician, the importance of angiographic embolization is growing for trauma care, but clinical decision supporting tool has not been developed well yet. Shock index, which can be calculated by dividing heart rate by systolic blood pressure, has been known to be concise and accurate tool. It has been used to assess patient status, especially suspected of shock status. Some modifications such as age-adjusted or change of values has been evaluated to be improve predictive performance. Recently, it has been used to develop prediction model for angiographic embolization in traumatic oronasal bleeding in a recent journal. So we hypothesized that for practical reasons, a concise index should be developed to be used in EMS and ED. Shock index probably provide higher predictive potential in developing index. We try to develop new index and compare its predictive performance with previous indexes. Below picture is one example of scenario using new developed index in real medical practice between EMS and ED. It was retrospective observation study using PATOS database version 1.0. After pre-processing, data from only two countries, Malaysia and South Korea, was used in this analysis. I'll further explain this point after introduction, but information about hospital management and vital sign data was mostly insufficient. Study population was selected as adult trauma patients transported by EMS, and primary outcome was whether angiographic embolization was conducted within 24 hours from ED visit. Variables including demographics, injury information, patient status such as vital sign or mental status at the scene and ED, management at scene and ED, severity information, and outcome information was collected and analyzed. We selected key factors to make prediction model. Key factors are variables which assume to be easily achieved by EMS at the scene and during transport, it, including at the entrance of ED. There were shock index at the scene, ED, and delta shock index, age group, sex, mechanism of injury, and alertness at the scene and ED. Principal component analysis was used to derive predictive coefficients from these key factors. In PATOS database, 2 Asian countries were selected and adult trauma patient transported by EMS without pre-hospital CPR was analyzed. New index was developed after principal component analysis for key components. Finally, only 3 components were selected and equation was derived like below. First, we compared study groups for demographic, injury information, pre-hospital and hospital information. Patient underwent angiography embolization was only 2.3% of total cohort. They showed several distinguished characteristics with higher scene and ED shock index with a higher severity. In multivariable logistic regression analysis showing association between angiographic embolization with key components. Scene shock index and ED shock index over 1.0, traffic accident injury mechanism, and altered mentality at the scene or ED showed significant association. New developed index showed higher predictive performance for angiography embolization compared to revised trauma score, age-adjusted shock index, or SIM score. Considering UDEN index, cutoff for 0.5 was most probable, but for others, it seems that score 1.5 may be useful in medical practice to screen high-risk patients. As you see on the right top, in graph comparing predicted and observed probabilities, score 3.0 may consider about 20% probability of intervention. So now I'd like to discuss about the issues while conducting this research. In this study, we tried to develop practical clinical decision supporting tool which can easily and rapidly used by EMS providers or ED triage nurse. It can be useful to determine receiving hospital or activate intervention team in case of pre-hospital trauma. Principal analysis, principal component analysis, which is frequently used method in machine learning analysis, data mining, or denoising. Simply, it is used to change data to lower dimension with preserving its characteristics. We used this method to derive coefficient for each key component for index calculation. Also, we wonder probably some institute may have no intervention radiology department, but after exploration, we found that all 29 institutions involved in this study was checked and at least one case of angiographic embolization was conducted. Apart from our original assumption, delta shock index was not included in this index. We assumed that pre-hospital care for worse cases may alleviate change of shock index, which does not provide much information for prediction. When you try to develop prediction model based on data, diagnostic test characteristics should be included. It often called as confusion matrix, shown in the white cells in the left picture. From this box, you can calculate accuracy, sensitivity, specificity, positive predictive value, and negative predictive value. We may interpret usability of the developed prediction model based on this result and clinical scenario. Overall predictive performance would be evaluated by area under receiving operating characteristic curve, which is usually called AURC, demonstrated in the picture on the right. It can be easily drawn by each value of sensitivity and specificity for odd cutoff value. As I mentioned, when you develop prediction model, practical uses of model in clinical environment is important. Just making statistically significant model with higher predictive performance does not confirm usability or research value. Also, choosing the cutoff value or advancing the predictive performance of model is important issue in research. When you're analyzing PATOS database, there is also some issues. It is somewhat difficult because, of course, it has prominent strengths of a big database with multinational, multi-center data with comprehensive variables. But when you're trying to analyze about specific hospital level intervention, such as specific surgery or embolization, detailed information may not available. In this case, we cannot confirm this angiography embolization is really urgent, or does it targeting the bleeding source, or which anatomic region of this procedure is targeted. Just what we know is the timing of intervention and is it embolization was done or not. So, by researchers' assumption, we define the primary outcome as angiography embolization conducted within 24 hours from ED visit. So some arbitrary definition by researchers could be necessary. Also, EMS setting is not universal, and data collection system is also different, which can affect integrity of pre-hospital vital sign or mental status information. When you explore the data according to each country, you may find out that distribution of severity of patient also varies according to countries. I would like to recommend you to consider this limitation of database when you design the analytic research based on PATOS database. Thank you for listening, and I will reply to any question if you mail to me.